Hi folks, this newsletter is a little different in that it's videos rather than a written text. So there are two videos below. The first video is about 6 minutes in length and it's about the Pro Adjuster. It's about how I demonstrate and explain how the Pro Adjuster works. It's consistent, comfortable, and computerized. I don't have to do any twisting and popping to get the spine aligned. Also, it's got the before and after results, so I can show the patient which vertebrae adjusted and show before and after results for that treatment and also from the previous visits. The second video, which is the most important video, is it's about why you should get your spine aligned on a regular basis. So be sure and check that one out. There's services that I offer you may not be aware of. Mary and I started out in 1985 specializing in sports massage. We were guest sports massage therapists at the '88 Winter Olympics. We were on Good Morning Houston 3 times demonstrating sports massage. And I was a sports massage team coordinator for the Tenneco Marathon for 7 years. So I've fine-tuned my sports massage skills to focus on working on muscle injuries. So they call it myofascial or active release technique. So when you develop these scar tissues, it limits your range of motion. An example of that is the shoulder. So we should be able to lay in the bed and lift our arms up, out to the side and have the forearms go all the way back. So when we lose range of motion, it's not necessarily age, it's that we've got developed scar tissues. So that's what I do. I go into the muscles and I break those up so that they spread again and move again. This is an example of before and after. So this is the belly of a muscle. You've got your tendon at both ends. There's actually hundreds of fibers in this. So this is showing where the muscle has torn. Collagen comes in and binds it up and forms an adhesion there, a little scar tissue. So I do this technique, cross-fiber friction, in different directions to break up that adhesion so the muscle fibers spread again, which restores normal range back into your muscles and the joints. I'm also a certified chiropractic extremity practitioner. I adjust shoulders, knees, elbows, just any other joint in the body. The most common are the knees and the shoulder. And also rib heads, where the ribs attach to the spine in the back. Those get out of alignment more frequently than people realize. And when it's out really bad, it feels like somebody's stabbing you in the back with a dagger, and it can radiate pain all the way into the front and mimic a heart attack. So if you go get checked out and you don't have anything going on with your heart, it's most likely a rib head, and I can help you with that. The other thing that I do is I'm an applied clinical nutritionist. So I work with pharmaceutical grade natural supplements to treat the body. You can pretty much replace the natural or the pharmaceutical grade prescription drugs. An example of that would be nitric oxide. As we get older, we tend to be deficient in nitric oxide, and I actually have a little test strip I can check people to see if they're deficient, and so we can offer the nitric oxide for them. In closing, I will be turning 70 in a couple of weeks, and I bring that up because I plan to work till I'm 75. So if you have any issues after looking at these videos that you think I could help you with, please give me a call. So thank you for listening and look forward to seeing you. Dr. Bill Nicole.